9. All right, Jim Walker.
Hey, thanks very much, Steve. This is Staying Healthy, a program brought to you by a number of medical folks in Green Valley and Sarita. This show brought to you by CareMore Health. And with us today, and forgive me because I know I'm going to butcher this doctor, but Khoubyari, Dr. Khoubyari?
Khoubyari, yes.
Khoubyari. How are you?
I'm doing well. Thanks
Good.
For having me.
You're a cardiologist, and I think that nothing is closer to my heart, no pun intended, than guys who can tell me what's wrong with it and work with us. I believe heart or cancer, I'm not sure which one is the number one disease nowadays.
Probably still the heart, but cancer is very close too.
Yeah. Why did you decide to become a cardiologist?
So that's a long story, but
we have plenty of time.
But actually, I went to medical school because I always like to serve people, and and what is better than providing a service that actually promotes people's health.
Yeah.
So that's the main reason that I went to medical school. And then when I was at the medical school, I was so fascinated with the physiology and the pathology of the heart disease, obviously. And then I realized that, the heart is the number one killer in the world.
Yeah.
In the world. So if I can be a part of this team to help people to reduce the mortality and morbidity, what would be an awesome job, right? So that's how I got into cardiology field.
Now, you have an interesting story. You originally had your education in Iran.
That is correct.
And what brought you over to America?
So I did my medical school back in Iran, and then I graduated over there, and then I came to the United States as a religious refugee, and to go to the higher level of education, because that was my goal. I mean, get into the best level of training and care that I was actually, dreaming for.
Yeah. Now, you did your residency at U of A, is that correct?
Yeah. So I did my residency in internal medicine at University of Arizona, and then geriatrics fellowship at the University of Arizona, and then cardiology fellowship at the University of Arizona.
Well, excellent. Journey. Yes, I was going to say lots of education.
Yes.
Do you have time to run a practice?
That's true.
What is the most misunderstood thing about the heart? Do we take it for granted too much? I know mine has been abused over the years, and I'm a diabetic on insulin, so you can say to me, boy, you really have messed up somewhere along the line. But
yes and no. I mean, yes, obviously, diabetes is a major risk factor, and so is the other ones. Like, smoking is a number one risk factor, and
smoking is a number one risk factor.
Yes, is the number one, and in fact, is the most, or I should say, the only modifiable risk factor. That is there, because by the time that you stop smoking, actually the risk of having any cardiovascular disease actually goes down significantly. Not the risk of the cancer, okay, but we're talking about the cardiovascular disease. Anyways,
so your heart will heal is when.
So you may not. Okay, you may not have had a heart attack necessarily while you're smoking, but it increases the risk of having cardiac event in the future. And yes, I should say yes, it to some extent heals, but on the other side, when you smoke, it increases the inflammatory state in your body, which puts you at a very high risk of heart attack. And when you stop it, so obviously the cause of the inflammation goes away, and then gradually body actually recovers. So, the risk goes away, and then the inflammation goes down. And then after years, actually, you completely go back to normal.
Where you were.
Yeah.
Now, does chewing tobacco fall into, is it the smoke or the caffeine or the nicotine rather that damages the veins, or if you're chewing tobacco, which a lot of folks do in Arizona?
It's not recommended, but the smoking inhalation is worse than the others.
Yeah, so the smoke affects the lungs and tightens everything up, or as
and then obviously the chemicals that are like in there, like carbon monoxide and thousands of chemicals that are like in the cigarette. Actually, they're affecting the wall of the arteries and destabilize the plaques that are there. And then the moment that the plaque ruptures, and that's the dangerous time that you may get a heart attack.
Now, can you really live a perfect life that protects your heart, or is it more you do what you can do and hope that your family history is not against you?
So family history and the gene obviously plays a very important role. We should actually consider that all the time. So there are people who have a very healthy lifestyle. They're taking care of themselves. It's just because of the bad gene, unfortunately, and having a significant family history of coronary artery disease puts them at the higher risk. And then you see those people like having a heart attack at age of 50 or 60. And, as I said, having a very healthy lifestyle, they run every day, they take care of their diet, but it's just a bad gene.
I know there was a runner, James Fix, who was a big marathon runner and died at 50, exactly what you're talking about. And it turns out there was something in the family history. That shut down his heart. I don't fully understand it. What's the most common cause of problems with the heart? Is when you get a patient, do you go in looking for something, or can you tell by their actions? Obviously, if they're 300 pounds or something like that, there may be a challenge. But how do you go about assessing their health?
So the most common, a type of a heart disease that is killing people, what we call it is coronary heart disease or coronary artery disease, which basically results in people having heart attack. But regarding assessing the people, it depends on, their presentation. In terms of acute setting, when they come to you in the hospital, in the emergency room, obviously, there are several things that need to be done, including the electrocardiogram, or known as EKG or ECG, that is very common to do, and then run some blood work, because if someone has heart attack, there are some lab work that can show you that this heart is damaged, and then that's how we can actually say that this patient has heart attack.
That measures something in the blood that says...
That is correct.
What is that it measures?
It's a troponin, actually. So it's a chemical that is coming from the heart when it's damaged.
It sort of says, hey, help me?
Yes, of course. Yes, that's true. And these are the basics, actually, of the evaluation. And then when someone has heart attack, comes to the emergency room, you need to take care of them like right away. So you have like ABCs done, and then if the patient has heart attack, needs to be taken to the cath lab for emergent revascularization that needs to be done right away. Or if they can be treated medically, that's a different story. But these are the basics of evaluating patients. Obviously, as you point out, look at someone who is like obese. Yeah, you already can say that this patient has risk factor, and smoking, as we talk about, and diabetes, high cholesterol. These are the major risk factors.
Now, if we live a healthy life and we start getting up in our 80s or so, and matter of fact, La Posada, which is a retirement home here in Green Valley, they have a big party for folks over 100. Wow. And there are about 18 of them.
Really? That's amazing.
And the question is, what gives out first? Is it your heart or your brain, or any guess on that?
It's hard to say.
I want to know why they're living so long.
As I said, the gene is very important, But obviously, having a very healthy lifestyle is another very important risk factor. They've shown that people who follow the Mediterranean diet, they live longer.
Yeah.
So that's important what you eat, and if you exercise every day, these are very important.
Do you feel exercise is a key?
It's one of the very important keys, of course. It is.
Okay. Well, Steve, you and I are going to have to walk a lot more or something.
No, that's very important, seriously, because it promotes the circulation, and of course with exercise you burn more calories, and then you use your muscles, which they use more sugar. So people who have diabetes with exercise, actually their insulin resistance goes down, their sugar actually improves, the blood pressure improves, and then the cholesterol actually goes down. So I've had patients that with diet and exercise, their medication requirement has gone down significantly, that some of them, they didn't even need blood pressure medication. They didn't even need a medication for diabetes anymore.
Well, I can tell you I was one at one point. I was a vegan who exercised every day and was off my medication. So you can tell I haven't lived the greatest lifestyle in terms of red meat. Is that a bad?
It's not recommended, obviously.
I know the cattle ranchers will come running in the door, but once a week, maybe?
Yeah, once a week, and if you can have the the leanest meat possible, because the fat that comes with the red meat is not good for us. Obviously.
Yeah. Now, in terms of, and we've got a number of questions I want to try and get to, but diet soda. For some reason, I have seen there was recently a diet soda study. I think it was out of Massachusetts General or one of those places, and they just said it is horrendous for you.
Soda in general.
Care to take a stand?
Soda generally is not recommended because it's not good for the health. Is synthetic, and
how did the synthetic combinations hurt you?
So there are chemicals. First off, like the regular soda, obviously it has a lot of sugar. So once you consume that amount of sugar, like in a little can, there are like 38 grams of sugar. And just
I know, it's crazy.
It is. Just like put that amount of sugar, like 38 grams, see how much sugar you consume with each can of soda. I mean, this is a lot. And then just imagine people who have like a big cup of soda, like 2 or 3 of them, like every day. So the amount of sugar that is in there, it obviously increases the risk of diabetes for sure. But the diet soda on the other side, they have sodium in it too. So sodium obviously is one of those things that.
So you have salt, you have sugar.
Yeah, you have like all the.
Nothing good for you.
No, you have all the ingredients.
But you can get a nickel back for the can. So, pay for your health. Now, cholesterol. Can you define cholesterol for me? I hear the doctors, my doctor, my poor doctor, is always yelling at me saying my cholesterol is too high. What does she mean? So,
first off, we should know that cholesterol is an important ingredient of the cell wall. Each single cell in our body has a wall, has a membrane. So the cholesterol is one of those very important ingredients of this cell wall.
It's a piece of the wall?
Yes, it's a piece of the body. Yes, actually, if we don't have cholesterol in our body, probably we cannot live. Because, as I say, it's one of the very important ingredients of our body. However, over years and years and years, the lifestyle has changed. So now we consume more fatty foods. We consume more food that they're high in cholesterol. We tend to see it more versus doing like work every day. Like our ancestors were like, farmers. So they were working every day and they're consuming less greasy, fatty foods as compared to us. So
it's non-processed food.
Of course.
It's not processed like McDonald's or Burger King.
They're high in like calories. So they have to compensate for the calorie with like, high cholesterol, the oil, because they're high in calories. So when the intake is high and the output is low, obviously, you're at risk. So the cholesterol is going up, and then yes, if the cholesterol, the total cholesterol is go above like 200, or if your LDL is above 190, is one of those things that
and LDL
is the lousy cholesterol, is the bad cholesterol, is
and what's the good cholesterol?
Is HDL.
Okay.
So yeah, these are the things that we'll look into, and obviously. We don't want you not having cholesterol because you cannot live without cholesterol, but too much cholesterol is not good for the body either. So that's why we need to get it under control.
So the body is unable to dispose of the bad cholesterol. Is that correct?
Or I should say that we use more of the ingredients.
We have to burn it up.
Yeah, and then we cannot consume that much of a cholesterol, and that's one of them. But on the other side, there are people who have certain genes that they cannot actually metabolize that cholesterol, because there is an enzyme in our body that many of these cholesterol medications basically are built based on that. And then some people, they have a bad gene that enzyme is not efficient enough. But overall, the problem these days is just because we consume more and we burn less.
So going back to the Mediterranean diet, it suggests more vegetables, fish.
Right.
Now,
and nuts, and then healthy oil, which is like olive oil.
And for instance, on olive oil, I look at that; it's still got a high fat content.
Yeah, but that's a good fat.
That's an HDL content. Can they put HDL fat so I don't feel so bad?
I'm not sure if I've seen HDL in that. I mean, I've never.
No, I've never. But I'm just saying.
No. So HDL is the good cholesterol that you can actually bring it up by doing exercise.
Mm-hmm.
So and then some people have the gene, actually their HDL is on the higher side, the healthy cholesterol is on the higher side, but exercise is a great way actually to increase your HDL. So
you can actually increase it.
Yes.
Now,
yes.
Does the HDL fight the LDL?
That's a kind of a protective actually measure. So yes, to some extent it does, but still, if your LDL is super high, we need to get that under control, definitely.
Okay, the follow-up question would be, there are a lot of medications out there for cholesterol. I'm sure I've taken every one, and the pharmaceutical companies send me thank you letters for that. But are the pills, is the medication just as bad with some of the cholesterol? You hear stories on the medication that they may not be good for folks.
So, yes.
And I know that's a challenge for you.
Of course. Tell me that there is a medication that doesn't have a side effect, right? I mean,
okay.
I guess living in this world comes with side effects.
Yeah. Life is a side effect,
yes,
yeah.
And it comes with risk, right? If you drive a car, you take a risk, and, because you're always at risk of, getting into a serious accident.
So how do you minimize the risk of the different medications? I know stay healthy, but how do you do the research to minimize the risk when you take a medication?
So one of the things is that when there are several medications, obviously they can affect each other's metabolism. They interact with each other. That increases the risk of the side effect, obviously. So that is something that the doctors who are prescribing the medications should take into consideration. But what I was trying to actually say that cholesterol medications, although they come with side effects, but their side effects, the most common side effect, the most complaint that you hear is like the muscle pain and the muscle cramps, which is uncomfortable. I agree. I totally agree. But a big part of it is coming from the mind effect. There has been some studies showing that giving placebo to patients and tell them that they take a statin, it gives them cramp. So, although they're not taking it, but it's just like the mind effect actually affects the body. But I always tell my patients that just see the risk of not taking a statin versus having like maybe a little bit of muscle cramp. I mean, which one is more important to you? Having a major heart attack, having a stroke in the future, or maybe some muscle pain or muscle cramp that many of them actually will go away. In serious cases, there are very rare cases. Yes, in those cases, obviously we back off. We cannot do it. But most of them, they can be tolerable. But unfortunately, the mind effect is very strong that once you take it, and then, I get muscle pain, I get muscle cramp. Damn, it's because of the statin.
Now, are we just too lazy as a society?
I guess yes. I should say yes.
Unfortunately. I look at myself and I go, well, maybe I should do an extra hour of work here, and then I blow off the exercise. And is it maybe our lifestyle? We put more time into work than we should. I'm sure you don't work an 8-hour day, or
I do. I do. I definitely do. I do work more than that.
Well, that's what I'm saying. And then the paperwork and all the rest of it.
And that counts a lot, actually.
The stress level. How does stress affect the heart?
It's very important because any stress actually increases the inflammatory state in your body, which is a known risk factor for having any coronary events. And that goes back again to taking statins. So the cholesterol medications known as statins, they're not only bringing the cholesterol down, but also they have anti-inflammatory effect, which is a very important aspect of this medication. So that should be taken into consideration. That's why one of those medications that are recommended when someone who has an acute event like active heart attack, one of the medications plus aspirin and the other things that are given to the medication is a statin because of the anti-inflammatory effect it has at the moment.
Now, is the inflammation from smoking the same as stress? Are they related?
I don't have any way to measure them, but probably yes. I mean, the stress can cause a lot of, can actually release a lot of chemicals in our body that increases the inflammation. I'm not sure it beats smoking. But they're both bad, of course.
Now, with all the advances in science, are we making progress on understanding everything going on with the heart?
Yes, I guess if you look at the life expectancy and the average the age that people used to live years ago and compare it to now, right? Because of all these innovations and evolution that has happened in medicine, and one of them is obviously cardiovascular disease and the prevention that we have done with cholesterol medication, with aspirin, and knowing the pathophysiology of this disease and trying to promote actually having a healthy lifestyle, healthy diet. So these all count, I mean, for sure.
Now, what diet-wise, what would be sort of a perfect menu for the week? Now, salads, do you recommend salads?
Of course, yes. But salad, the dressing is the issue, The dressing that we buy from the supermarkets, those are the problem because many of them are coming with high in calorie, in fat, and sugar. So if we can make the dressing at home with healthy ingredients, that would be awesome. Salads are great for the body.
Now, where do you get your protein from? I know when I was a vegan, I didn't always get the correct amount of protein or vitamin B. How do we go about, well, first we have to educate ourselves. I would say that's probably number one, correct?
Of course, yes.
I see a lot of folks have no idea what makes them tick or what makes the heart tick, literally. Where do you get the protein and vitamin B if you're on a restricted diet?
So that's a good point. First off, completely restricted diets can be a challenge, obviously. But you can still get your protein from different sources, like for example, beans and scrambled. They're good sources of protein. If you're not completely vegan, obviously, and then you try to just stay away from processed and red meat, fish is a great source, like salmon. They're great source of protein.
I know I eat a lot of salmon. Now, what about lobster? Isn't that high in cholesterol, or shrimp, or?
Yeah, they are, and they actually, all the shellfish can actually put people at a higher risk of gout for people who are susceptible. So yes, that's why why probably fish is a better way of going, or like going with, poultry and like chicken, like not those chickens that are like, again, like, processed,
Yeah, you want to get the free range chicken.
Yes.
And name the chicken before you kill it. But,
sure.
But no, seriously though, on the free range and not processing it, I see many people now in a supermarket, which I didn't used to see years ago, reading the labels.
Mm-hmm. That's very good.
I've always wondered whether we should have label reading classes for kids in school.
That's an education that you talk about.
Yeah. And for instance, we now have Sprouts down here in Green Valley, so we've got that type of thing. What if you're talking to folks such as myself who may have passed the 60 mark?
You don't look like that.
Yeah. Well, you know how alcohol works; it preserves you. So,
sure.
No, I'm teasing. But what zone does that put us in here? For instance, the average age in Green Valley is 71.2,
mm-hmm.
and a lot of these folks make me look. They're out there playing baseball, riding 50 miles on their bike.
That's amazing.
Yeah,
that's awesome. That's a lifestyle that you want to have when, all your life, especially when you get to that age, because that tells you that, you have lived a very healthy lifestyle, that you've had strong muscles, and you can, you're capable of accomplishing those even if you're 70 or 80. That's amazing. I've had patients who are, riding their bike when they're 80 something, and they're awesome. They're awesome.
Yeah. Well, it makes me cry, But now, what's your best advice? Seriously, folks are going to have a glass of red wine, or folks are going to have an occasional cigar or mm-hmm. something like that, or not walk the straight healthy line, so mm-hmm. to speak. What's the best way to handle your life so you can keep it ticking and something else will kill you?
So talking about the drink, actually, so there has been several observational studies showing that moderation in drinking may be good for the heart. Now, actually, they're talking about maybe the amount of alcohol that they use to say that it's fine regarding the cardiovascular disease. Now they say that, maybe that's too much. Maybe we should bring the limit a little bit lower and make it a little bit, stricter. However, cigar or cigarette, never, been recommended. Once in a while, nobody knows. Probably, if someone want to have fun, nobody knows. But obviously, it's not a good thing for the body at all. Going back to drinking, the problem with drinking is that it comes with other problems. Drinking can increase the risk of cancer. The drinking can put people at risk of liver disease and cirrhosis. Mm-hmm. Drinking can increase the risk of high blood pressure or hypertension. So it's not just about the heart; it's about the other systems of the body that they might be at risk by, regular consumption of certain amount of alcohol. So yes, heart-wise, cardiovascular-wise, there might be some benefits if you drink like maybe a glass of wine every day, which is probably fine, honestly. But the risk of cancer is there because alcohol has shown that increases the risk of cancer. And whenever you buy a bottle of any alcoholic beverages, they all say that, hey,
they've got more warnings and information.
Right.
Well, we appreciate you coming by today. I know we'll probably talk with you again in the future.
My pleasure. Thanks for having me.
And it's been very educational. I've learned a lot, and I'll probably get your phone number and say...
It would be my pleasure.
Yeah, no, it probably wouldn't. It's folks like me that will keep you in business for the rest of your life.
So yes, yes and no. So I like the business of prevention. One of my colleagues and mentors say that if at the time that you ended up having a heart attack and going to the cath lab to fix an artery, that's a failure that, that you ended up there having a heart attack. So, yes, I like you folks to keep my business going, but as a prevention, that's what matters, because that's where medicine future is. We need to work on prevention, make sure that we address all the risk factors, promote a healthy lifestyle, healthy diet, and that's why I'm up for it.
Terrific. This has been Staying Healthy, brought to you by CareMore Health.
1080